This is case of the day, and today is Thursday, the last case of this week, and I'll be back next week. Do remember that this is all created manually without the use of AI. And today's is an unusual topic. It's case 143, titled MRI of Polio Afflicted Muscles. So this 40-year-old came in today with a history of polio at age 1 for an MR myositis protocol because there was deterioration of function and a thought that maybe there was a coexistent myositis. And for the protocol and other things, there are 3 cases now on that I've done over the last 9 months on different forms of myositis, and I have, I think, one link on the top right that you can see. This patient had asymmetric involvement of the muscles, so atrophy and fat infiltration of the posterior compartment on the right, anterior compartment on the left, no edema, no inflammation. We also did a quick run through the thorax and the abdomen, and again there's asymmetric involvement of the chest wall muscles. There are no psoas muscles. I mean, they're all fat infiltrated. And then the abdominal wall muscles, both posterior and anterior, are asymmetrically involved. Marked atrophy and fat infiltration of all the thigh muscles and leg muscles. And it's interesting how asymmetric this is. The left leg is more gracile than the right, and that happens as well. Now, it is possible that if a patient gets symptomatic and deteriorates, it is likely a post-polio syndrome, which is a clinical diagnosis and a clinical syndrome. India was declared polio-free in 2014. Last case was 2011, and it was a hotbed of polio in the 70s and 80s. And it is estimated, that is 1970s and 80s, and it is estimated that worldwide there are about 20 million people with polio alive, of which 1/3 are in India. So that would be about 3 to 7 million polio survivors who are currently in the age group of 50 to 70. Now, which means that some of them may land up for MRI for the polio for whatever reason, and sometimes these are picked up incidentally. And if we have a history, that's great. But if we don't, then we should be able to identify these poliomyelitis changes. But the funny thing is, and as usual, I decided to look up literature because I don't remember reading anything much on MR and polio. And guess what? The only paper, the paper with the largest series, is from 1996, which is, if you see 06, 1620s, that's like 30 years ago. And that too from a rehab medicine paper where they were looking at isokinetic strength. And then this is from my Zotero list, and you can see that 86 there was one case reported in the first paper on MRI and normal and pathologic skeletal muscle, one case each in all of these. And there's one image of one polio patient. So 5 patients here, 6 in that paper, 11 patients reported in literature, in PubMed, as far as polio is concerned. That's it. That's weird. It's not uncommon to come across patients with polio in India. This is a 70-year-old who came for a whole body MR for cancer screening last year, and you can see these polio changes in both the limbs, very asymmetric. You can see them in the pelvic girdle. The anterior thigh muscles are gone, the lateral muscles are gone, etc. This is a 68-year-old known to have right polio, gracile limb, prior surgery, left hip pain. You can see the prior surgery on the right. But the left as well, while there's a little bit of a bursa here, there is atrophy and fat infiltration asymmetrically of the posterior compartment muscles that may be contributing and may not have been recognized. And we can even see that the tensor facial artery, etc., are all atrophied and fat infiltrated. This patient had dermatomyositis over and above the polio. So right side, you can see the gracile limb and the polio. On the left, this is likely a combination of polio and DM, but there is edema. And the edema has a mixed foggy honeycomb pattern. And the last case that I did about a couple months ago, I talked about all these patterns of edema. um, and even on the right, there's a little bit of edema. 15 months later, the edema is gone because the patient was put on treatment, but the rest of the atrophy and fat infiltration continues. So there is a substantial number of polio patients above the age of 50 in India who may come for MR for polio or for other reasons. And it is important to recognize these changes: gracile limbs, atrophy, fat infiltration of unrelated muscle groups, because you know how polio occurs, right? Anterior horn cells are affected in an asymmetric manner, and so the new nerves that they subtend land up affected, and so we get denervation, flaccid paralysis, and atrophy of the muscle. So it could be any combination of any groups, unlike the genetic and the inflammatory myopathies. And at the end, here's a challenge. If anybody wants to write this up for a paper, I have 7 proven cases over the last 3 to 4 years that I'm happy to share. And maybe if you have a couple more and you want to add this up, we would have the largest series in the world of just describing the findings and talking about all of this, right? That's a challenge for whoever's interested. That's the Rat Protect next month, my WhatsApp channel. Thank you so much for viewing this.